what has revolutionized bladder cancer treatment? Identifying the change of prognosis or your life expectancy is determined by, not by the primary tumor, the cancer which leaves the tumor very early. This is a very important concept and really helped us to understand why the prognosis has changed in your favor. Simply because we have identified a cancer is like an iceberg. What you see in the scan is only the tip of the iceberg. What is beneath the surface is where majority of the cancer is and unfortunately cannot be seen. So we've identified there is no point delaying what we call the systemic treatment. Any cancer treatment, there are basically two components. Number one, what you can see in that scan. Usually your surgeon looks after that bit. As a medical oncologist, is basically to treat it what is underneath that surface, because that's what goes to other organs, nicely embed in your organs like the liver or the lung. We still cannot see those things and eventually sort of take over that organ and cause all kinds of problems. I specialize in sort of seeing bladder cancer patients in particular, and this is very common in bladder cancer where we recognize we need to start targeting what is beneath the layer, not what is seen in the scans. So again, sort of emphasizing, if you look at the cancer, this part cannot be seen, this part can be seen in the scans, and I target this because this is what really changes your life expectancy. This initially old world chemotherapy like a platinum or cisplatin was basically given to very good effect, and it managed to do two things: improve outcomes. First, it gives you valuable prognostic information about what is happening in real time to the cancer, because we do a scan before starting treatment, we do a scan after the treatment, and then we would know if the tumor has shrunken, that this chemotherapy will work, not just in that area, elsewhere which we can't see. Very valuable prognostic information. And at the same time, people who have like shrinkage of tumor, and let's say they have completely shrunken the tumor and the tumor cannot be visualized, either when they do the resection, when they do the surgery, or when they actually do another scan, these people tend to do much better. Valuable real-time prognostic information. So I'm very interested to talk about one of these clinical trials, which is actually happening in US and several other stations as well. Initially, it's called EV, which is a very complicated name, but EV is an easy one to remember. Combination with Pembro, Pembrolizumab is a form of immunotherapy. We knew that, especially with a stage 4 cancer, this is a very effective combination rather than traditional chemotherapy. Now what we're trying to do is that migrate that into before surgery. So I'm very passionate, especially when it comes to bladder cancers or some of the other cancers as well, trying to give that systemic treatment before surgery. That makes all the difference in terms of better surgical outcomes, better prognosis as well. So this EV Pembro combination, which has shown very good effect in stage 4 cancer, is now being trialed. Now this was done in a group of patients who are very frail, so we cannot normally give traditional chemotherapy, and it showed a significant improvement, like almost 50% reduction in people who progressed cancer or died from cancer, almost a 50% reduction. So what we want to sort of identify is that can this regime, EV Pembro combination, especially in the neoadjuvant setting, can it actually sort of do this sort of magical outcome? I would think it converts a significant number of people from ever getting the cancer back and giving a cure. We are very passionate about curing cancer. You have to kind of always discuss, because I don't think every surgeon is keen on neoadjuvant, or that means pre-surgery treatment. To re-emphasize what I said so far, what kills you in terms of a bladder cancer is what you cannot see in the scans. That's where all the action actually happens. Treatment before surgery targets that part as well as what you can see in the scans. It gives you valuable prognostic information, helps to live longer, shrink the tumor, and have better outcomes. Before surgery treatment is, if you can have it, majority of the cases, that is the way to go.